This podcast is not meant to be professional advice of any kind. It is meant to be informative and entertaining. If you make any changes to your life, see the appropriate professional before you do so. What kind of super ager are you? Go to ageist.com/quiz. Take the super ager quiz, and we'll send you directed, personalized information to help you super age the best that you can. Welcome to Super Age. My name's David Stewart. I am the founder of Ageist and your host on the Super Age Show. We talk about how to live healthier, how to live longer, and how to be happier. And who doesn't want that? Today's show is brought to you by Inside Tracker, the dashboard to your inner health. Go to insidetracker.com/ageist. Save 20% on all their products. Today's show is also brought to you by Timeline Nutrition with their breakthrough product, MitoPure, the first clinically tested urolithin A supplement, which is showing tremendous results for mitochondrial health. Go to timelinenutrition.com/ageist, use the code ageist at checkout, and save 10% off your first order of MitoPure. This show is also brought to you by Element, LMNT, my favorite electrolyte mix. It's what I put in my water in the morning, and it's what I put in my water at the gym. Go to drinkelement.com/ageist and receive a free 8-serving sample pack with any purchase. Welcome to episode 152 of the Super Age Podcast. It's great to have you with us. We're going to be dropping this on September the 20th, 2023. Hey guys, so this week we've got Dr. Kelly, my favorite dermatologist to the cognoscenti around here anyway. And she's going to be talking about lasers, skin lasers. She's an expert on that. That's her thing. And we're going to talk about various other things to do with skin and Jimmy Buffett's tragic passing from a very rare form of skin cancer. She's going to have some thoughts on that. So we're going to get to her in a few minutes. People ask me a lot, why do you do what you do? What's this sort of driving thing? And why are you attracted to certain people and not others? And I come from a small town in Western New York, basically a farm town. There was a little state university there. My parents were divorced when I was really young, and then my dad passed away in a car accident. And as a kid, I was sort of a bit much for everyone. This is the 60s, right? 60s, early 70s. And do your own thing was not really the way it is now anyway. So people now are very much encouraged personal expression, be who you are. Back then it was hippies were around and stuff, but it was really more about conformity. It was like, don't stand out, keep your head down. And even my family would tell me, like, don't be exceptional, essentially, which was sort of a lesson that I learned early on. Don't let people know about your inner life because they're not really going to be into it. And my family, the teachers, people around me really didn't, they just wanted less David. They just wanted me to sort of be less and just, sort of be like others. And that experience has really shaped me. And it is one of the things that sort of drives me to be the person I am today. So, the thing that gets me going every day is to just try and be the best version of myself. And it's sort of like pushing back against the stuff that happened when I was a kid, like, be less than. And so now it's like, well, no, I want to like fully actualize all the things that I have. And I think sort of going along with this is this lifelong appreciation I've had for the other. Because I spent the first, 25 years of my life being the other and being very much unlike others and sort of like not having a roadmap on how to navigate things, like not really having mentors, not really having people show me the way. And my mom did the best she could, but, I don't know this is the right word to use, but it was disappointing. I wish I would have had more. And she did the best she could, but, still, I wish I had more. And so this appreciation for the other, when I was a photographer, like on my crew, there just were no straight American white guys. Like it was always something else. And I've sort of always understood what it's like to be an outsider. And now, with Ageist and with Super Age, being older to an extent is sort of being an outsider in a weird way. Like we should be at the center. The way the world is today, at least here, I mean, I live in America, so very youth-centric. So championing the other, and in this case, people who are a little older. So that's a little bit on how I got to where I am. So I hope that makes sense and answers some of the questions that we get, like, why is he doing all this? Well, that's why, because I sort of got squashed down when I was younger and wasn't allowed to, fully express me the way I wanted to. So now, I can do it a little better. So I'm hoping all of you guys are doing the same thing too. I'm hoping that everybody out there feels that they can express who they are today to the fullest of their abilities, because time is short, right? Like if not now, when? And you guys, each one of you are awesome in your own way. And I just want you to know that. We're all so unique and we all have so much to offer in a very special way that's unique to us. Keep that in mind out there. Hydration is not just about pounding water. We have to have some electrolytes in there, specifically sodium, potassium, and magnesium. My favorite electrolyte mix, the one that I use every day, is Element, LMNT. One of the things that I learned last year was the importance of sodium. We may actually not be getting enough sodium. And I know there was a lot of sodium fear out there. And it's true, if you have hypertension or are pre-hypertensive, you do want to check with your doctor. But for most of us, having sodium actually helps us to absorb water. And in fact, drinking straight water without any minerals in it, we will be pulling the electrolytes out of our system. Go to drinkelement.com/Aegis. That's DRINKLMNT.com/Aegis. Get a free 8-serving sample pack with your next order. My favorite one is citrus salt. What's yours? Let me know. Today's show is also brought to you by Timeline Nutrition with their breakthrough product, MitoPure. MitoPure is the first and only clinically tested, highly pure urolithin A postbiotic. There have been over 300 published scientific studies on urolithin A, including human-completed and ongoing clinical trials involving over 900 participants. The results are impressive. By energizing cells, MitoPure is revolutionizing cellular aging. Urolithin A is the only known substance clinically proven to trigger a crucial recycling process within our cells called mitophagy. I've been using MitoPure for several months. The members of our scientific board and their families use it, and many of our friends use it because we have read the science and we can feel the difference. This is a product I'm going to be taking for as long as I possibly can. Receive 10% off your first purchase at timelinenutrition.com/Aegis. Use the code Aegis at checkout. Hey, just a quick reminder that after my conversation with Dr. Kelly, we're going to do Just Try This. Just that little tidbit that may help you live a little healthier, a little happier, a little longer. We're going to get with Dr. Kelly right now. Hey, Kelly, welcome to my house.
Thanks. Thanks for having me.
We almost never do these locally. They're always on Zoom, and great to have you here. You're a dermatologist, so clearly we're going to talk about all things skin. First off, like top of mind, I find your job and people who are in plastic surgery, people who deal a lot with appearance, unlike the other forms of medicine, I break my leg or I've seen an anesthesiologist or something, there's a real psychological component to what you do. People look in the mirror, and I'm included. Sometimes I have these like fits of dysmorphia. It's like, oh my God, I look like this. Dr. Kelly, oh my God, you see this? How do you deal with hysterical people like me?
Oh gosh. I mean, I've been one of those. That's how I deal with it. I mean, any sort of medicine requires a lot of empathy, and in aesthetic medicine, your empathy is, kind of shifted away from like empathy towards the sick and dying to empathy towards the people who really want to change, or make something better. So I don't know. That's me. I think you have to put yourself in their shoes and you have to understand where they're coming from. It's, and certain personalities, it's easier to do. You have to listen, because sometimes you can't go in with preconceived notions about people should be acting, because you don't know what's going on in their life, So you have to go in and you have to be quiet and listen, and then put yourself in their shoes and have empathy like every physician should.
I can just foresee, I mean, this is like something I would do. I would like call you up and it's like, oh my God, you got to see me right away. I have this like thing on my face or something, and there's no thing there. It's just like I've sort of imagined it. And, you would look at me and then you would have to sort of deal with me like a crazy person. Like, I understand that you imagine this, but maybe it's not there.
That's not the first thing that I ask when someone says, oh my gosh, this thing you have to look at, you have to get it off, and I can't see it. The first thing I ask is, do you have a magnifying mirror? Because that is 100% of the time. Yeah. How did you know? That's where I saw it. Well, okay. Throw away your magnifying mirror, because nobody else is looking at your skin in a magnified fashion. And yeah, those things are horrifying. I mean, I don't have one at home, but if I go to a hotel and it's there, even I'm like, what is that? So, but I never think it's trivial. I mean, as a dermatologist, I went through, 13 years of school and, 5 years of training, 16 years into dermatology. Like, it's a very, honed skill. And so you can't like assume that everyone's going to know what you're going to know. So I never would think anything is frivolous or anybody's frivolous. But I love, my mom recently, was in the clinic and, what's this or what's that? Or, and I'll, give the answer and she'll be like, well, how do you know? Like, because this is my job. This is my job, Mom.
That's really funny. How do you know?
How do you know?
I think only a mom can say that, though, right?
Mom can say that, yeah.
Like, I would never say that. Like, how do you know? Of course, like, trained professional.
Yeah.
Funny. We were talking at some point the last time I went to see you, and you beautified me. There was, you were talking about this like halo thing. So what's a halo? It's got a great name, by the way.
Yeah.
I love a machine called a halo.
Yeah. It's a great treatment. Well, the halo is a fractional resurfacing device. Fractional resurfacing is where we either remove or sort of cook like a tiny fractional column of skin. And we do that all over the face in like a pattern. When we treat the skin with fractional resurfacing, it makes it more healthy and helps with brown spots, texture, fine lines and wrinkles. But it also decreases your risk for skin cancer. And it kind of gives you this glow. Whenever you get new collagen under the skin, it changes the way light reflects off your face. And so we call it like the halo glow. And that happens like about 3 months after.
How long does the halo glow last?
The halo, it doesn't last forever, but it starts around 3 months after the treatment, and it probably lasts about a year, and then you need it again, maybe a little less than a year.
Oh.
Yeah.
Yeah, that's the thing about everything changes, right? Cells in your body, they're just living and dying and growing and changing and
Yeah, I mean, I tell people, when people ask me like, how long is this treatment going to last? You want to say in your head, it's not lasting. It'll never, the moment it's done, it's good. Because your body is changing. It's changing all the time. Aging is relentless and it keeps going forward. And so anti-aging has to be relentless and therefore sort of like a ritual, something that you enjoy and something that you do in a planned and regular fashion.
So as you're describing this, cooking of the skin sounds profoundly unpleasant. I'm guessing when you cook someone's skin, there's some sort of anesthetic applied here?
Yes. Yeah. So for the halo, we do topical numbing. And then I really don't like to see people in pain. So we usually add a bit of injected anesthesia as nerve blocks or in certain areas that are a little bit more painful. And then it's really, really tolerable.
Does it smell bad?
No. Mm-mm.
I'm just thinking like cooking flesh. Ooh.
Yeah, I mean, so we do use like a smoke evacuator so that you don't smell it. But so every single laser, I mean, the ablative and non-ablative lasers, the whole principle of a laser is to selectively destroy a structure by heating it up, but leaving the surrounding stuff intact. So, when you destroy a blood vessel, you're like cooking the blood vessel from the inside, but you're leaving the normal skin behind. Same with brown spots. And then this particular laser is absorbed by water. So the different wavelengths are absorbed different ways, but different strengths or different intensities by water. And the ones that are not quite as intensely absorbed by water are the ones that cook the skin, and the ones that water absorbs really intensely remove the skin. So the halo is both non-ablative, which is the cooking, and ablative, which is the vaporizing or removing of skin. Ooh. Yeah. So 2 wavelengths in one. That makes it a unique device in that sense.
I had the now very famous Brian Johnson on the show about 6 months ago. And Brian, when he came on, he had all kinds of like scabs, like wounds on his chest and a little bit on his face. And he told me he does IPL laser like weekly. Mm-hmm. And it looked really messy.
Well, he probably doesn't do the same area weekly because, it takes about a week to heal from IPL on the face. On the body, it can take 2 and sometimes even 3 weeks to heal from IPL. So if I had to guess, I would say he's doing one area and then doing another area and just like rotating through. I think that's pretty genius, but I'm biased.
Why do you think that's genius?
Well, I mean, so IPL is one of those. So now we have data that fractional resurfacing lasers, and we always kind of suspected this, but now we have clinical data that fractional resurfacing lasers prevent skin cancer, both the non-ablative and the ablative. So when you're doing fractional resurfacing, you're decreasing your risk for skin cancer, probably, or at least by this one study, by about 2 times, or maybe a little bit more. But fractional resurfacing is kind of like not something you want to do all the time. It takes a lot more healing. There's a lot more in that week while you're healing. It's a lot more. But IPL can be pretty mild. And we have good data that IPL also is anti-aging. Like it changes the gene expression in your cells towards a less aged,
so it's not just a collagen thing. You're changing the gene expression.
Yes.
Mm-hmm. Oh, fascinating.
Yeah. It was a small study that showed this, but they had they treated 4 arms. They had control arms of young skin. They had control arms of old skin, and then they had the treated old skin arms. And the treated old skin arms gene expression looked like the young skin gene expression, whereas the old skin that was untreated didn't. I don't know Brian Johnson, but I know that his goal is to change his, chronologic age. And that is a great way to do it. And it's a little bit easier. You don't always have to look scabby or crusty after IPL.
IPL, is that something that you can use on like any skin?
Yeah. Well, it can be a hair removal device, and so you don't want to use it on hair-bearing skin that you don't want to remove the hair on. But yeah, you could put it on. You could treat any skin with it.
The risk reduction with the ablative lasers, I get that right?
Mm-hmm.
Is that simply because you're removing cells, or you're selectively removing damaged cells?
Nobody knows for sure. But it's probably because it induces, a healing process that recruits kind of like newer, younger cells. The mechanism is not known for sure, because it could have gone the other way. Skin cancers and pre-skin cancers divide faster. So if you're removing like a column of skin and you're hoping for it to populate from skin that's surrounding, it could have been the scenario where the faster dividing pre-skin cancers and skin cancers filled in that hole.
Right.
But it didn't turn out, it didn't, it doesn't turn out that way. It actually improves the health of your skin.
All right, I'm going to give you a totally non-scientific idea here that what happens is because the skin gets damaged, you have this strong immune response, and then your immune system sees there's certain DNA damaged cells here that got to go, and then they remove them along with healing your face. I don't know.
Yeah, it could be. It could be that for sure. Yeah. I mean, so fractional resurfacing doesn't create a scar, but it definitely, turns on some sort of healing response, not necessarily the same wound healing response that would create a scar, but healing response.
Yeah. Interesting. I saw what Brian looked like coming after his IPL. What happens with something like halo, which sounds like more invasive? Like, what does somebody's face look like after you do that?
Well, okay. So the halo can be used in a variety of different ways. It could be used in a really low density, non-ablative way where you're just using the non-ablative wavelength and not the ablative wavelength. Or you could do it like I do it, where you're doing a pretty aggressive ablative, non-ablative, and I combine it with IPL. So you do the IPL first, and then you do the halo second. In that scenario, you have a week of downtime. It takes a week for your face to heal, no matter what sort of laser, except for the strongest, like fully ablative resurfacing. All of the lasers take a week for your face to heal. Off the face, it gets longer. So the neck and the chest, like 10 days to 2 weeks. The arms and the hands, like 2 weeks to 3 weeks. The legs are more like 4 to 5 weeks, sometimes 6 weeks. Yeah.
Ouch.
But I've done these lasers and they can be done anywhere on the body. So just talking about the face, you have a week of downtime. And here at high altitude, the face really swells because you don't have that atmospheric pressure like pushing back.
Yeah.
So I tell people, you're going to wake up in the morning and you're going to look in the mirror and you're going to say, who is that person? And I try to like over exaggerate, like your phone isn't going to recognize you. You will have to put in your PIN code. You're going to be swollen. You're going to look funny, and then almost every single person calls and said, I know that you said that I'd have a lot of swelling, but is this what you meant? And they send a picture. So swelling is always with the halo, the way that I do it. And then you have kind of redness and like little dots on your face that look vaguely like sandpaper. And then as the swelling goes down, they feel like sandpaper, and then you start to peel. So that's the story with most fractional resurfacing devices. When you use the halo in a lower setting, it's much less swelling, less scaling, less peeling, but yeah.
Wow. Don't plan any dinner parties after halo.
Oh, I went out to dinner after halo once.
You did?
Yeah, I just sat in the corner. It's remarkable, how people don't really notice. You feel very self-conscious when your face is on fire and you're, puffy and swollen. Other people just don't notice if you're in a dark room sitting in the corner. Yes.
Wow. Okay.
Yeah. But yeah, that's me. We're all different in that regard.
So what are some of the other things? I mean, clearly the thing to do here is, don't DNA damage the cell. Oh, the other thing I wanted to ask you about this DNA damage. So if you have cells in your skin that are damaged by DNA, did they circulate through your body at some point, causing other, does this migrate to other places?
No.
They just stay there.
Yeah.
Okay. So they can't suddenly they go somewhere into some organ and they start some trouble there.
No.
Okay. That's good to know.
Yes.
Yeah. Okay.
Yeah. It has to be cancer to spread.
Okay. Yeah. We don't want that.
Yes.
Okay. So people should be wearing mineral-based sunblock. Mm-hmm. If they go out in the sun, especially here, because we're at high altitude and it's sunny all the time. It's like being in a microwave, especially when there's snow. It's just
So I don't know if you knew the statistic, but for every 1,000 feet of altitude, the sun is 5% stronger. Yes. So we're here probably 65, something like that. Yeah. So
that's 30%. 40% stronger.
Yeah.
Yeah. And then if you have it reflected off the snow, it's just.
Yeah, it's coming from all directions.
Wow. Yeah. So what are the other things that you're telling people to do? Like, I know some people really love the whole ritual of product, and I'm going to put this product on this, that, and the other thing. And this is sort of their wind down method at night. I'm sort of semi in that camp. What are you telling people to do?
Well, so some of the things have to go on in the morning. So it can't just be your nighttime, like, wind down routine. Things that go on in the morning, obviously sunscreen and antioxidants. And then things that go on at night, like exclusively at night, would be like retinoids. And then everything else can go on in the morning or at night or both. I divide, when I'm talking to someone about anti-aging skincare products, I like to think of things in a framework, because I don't like to tell somebody you have to use this product, you have to use this product or whatnot, because everyone has their own favorite products that they use because they think feel good or whatever. And so what's important is that you're hitting all four of the categories. So the categories are sunscreens, antioxidants, exfoliants, and that's kind of like an oversimplification of that category, because I put retinoids and glycolic acid in that category, and they don't do more than just turn over the epidermis. They go deep into the dermis and stimulate collagen production. But there is some thing to be said, or there is an anti-aging effect of actually physically exfoliating dead skin cells and creating a turnover. So there's physical exfoliants in that category too. And then the last one would be like regenerative serums, or regenerative peptides. This is like a really broad category, but generally they're molecules, like small little proteins that signal the skin to do different things. Like, for instance, there's one that tells the skin to eat up dead collagen and elastins so that new collagen and elastin can be formed. There's one that makes the epidermis thick, like turns on the stem cells of the epidermis. And, an aging epidermis is thin and flat, and a young epidermis is kind of undulating and thick. So that particular peptide thickens the epidermis. There's one that goes into the skin and tells the skin to make more connections between the epidermis and the dermis, which makes the connection or the skin more healthy. So it's like a variety of these regenerative serums, and you can't use them all at once.
These things work?
Yeah, they work. Yes,
wow.
They do.
It's a silly question, but what you're describing sounds like kind of magical.
Yeah, I think that the topical products that have good science behind them are very overlooked part of anti-aging. I think that is probably the most important thing that we do. Like, if you can't do lasers or injectables, topical products make a difference.
In normal skincare, seemingly people can say anything about anything. It's like, oh, you look youthful after 7 days, or I mean, how many times have we seen
radiance, that? Luminosity.
Yeah, exactly.
Like, what is that?
Right. How does like a normal person discern, like, if I want a peptide that's going to better link my dermis with my epidermis? How do I know that this works? Like, how do you discern?
Well, I think so. There are a couple like broad categories where you can get your skincare products from. Like, one would be the drugstore, one would be the department store, and the one would be a spa, and then another one would be your medical, dermatologist's office. And dermatologists and other, medical professionals tend to like to see like the clinical evidence. We like to see randomized controlled trials. We like to see objective measurements, like, this really does increase. Like, I took a skin biopsy and I can see there's more collagen and elastin in there. And so that segment of skincare products are, what I think you can really depend on. And there are, a variety of different brands and things.
So I'll just ask you.
Yeah. Yeah, just ask me. Yeah.
This is all baffling to me. What do I
Exactly.
What do I do and when do I do it? Yes.
And then I would say, like, I'll give you a grid with those 4 categories: sunscreen, antioxidants, exfoliants, and I would tell you to put, them in those 4 categories, what you're using. And then if you want to change stuff in and out, I think it's helpful. I think it boosts, the improvement if you're changing things all the time.
Wow. Okay. That's so interesting. I feel like sometimes I should know so much about these things and I don't. And I didn't know this was like a peptide thing that did that. That was fascinating.
Yeah. I'm waiting for you to say, how do you know that? Just kidding.
Oh, well, I know how you know that. You're a highly educated professional.
I'm kidding. I'm just kidding.
I mean, that would be like somebody, like in my old career, if I said, I think we need to change the lens on the camera and do this. And somebody said, how do you know that?
Yeah. Because I just do.
I just do. Right? This is knowledge I have. Okay, so I had a reader question.
Okay.
This may not be completely out of your sphere, but maybe you know something about it. So the question was about lymphatic drainage and something called Brazilian lymphatic drainage. I don't know anything about these things. Is this something you ever heard of?
No. I mean, we do refer people to physical therapy for lymphatic massage and lymphatic drainage. And it's usually in scenarios of swelling, either lymphedema or lipedema, which is where you get extra fat and it's painful. So massaging, the areas where there are high flow lymph areas, like in the groin, and moving fluid up and then wrapping the body, is a medical, strategy. But I'm sorry, I can't answer anything about Brazilian lymphatic drainage.
I think if you put Brazilian in front of anything, it just sounds like
exotic
and it must be better. It's Brazilian. Oh.
Yes, I think so too. It must be. Yeah, it's really.
Your husband is Brazilian, so clearly,
is. I mean,
Brazilian husband. Yes,
can't argue with that.
Are you seeing any interesting things out there on the horizon? Technologies, peptide stuff, machines, things that you think are interesting that may be coming to market that people should know about?
So I really keep my finger on the pulse of lasers. That's my, subspecialty within dermatology. And as far as laser technology goes, it's usually pretty quiet for like decade to more at a time. And then there's like a big burst in technologies. And, we're sort of kind of in a quiet spot right now, but I do believe that soon there'll be some new devices, fractional resurfacing devices and technologies. But the latest right now is an anti-aging treatment called Ellacor, which is called microcoring. So instead of removing skin with lasers, what we just talked about. And when you remove skin with laser, either by cooking it or by vaporizing it, it usually leaves a cuff of coagulation around it so that those holes don't collapse. The improvement you're seeing is from a wound healing response or a healing response, not from, actually taking out skin. Like you're not getting tightening from taking out skin. So Ellacor is microcoring, which uses no heat at all. It's just a tiny needle that removes a core of skin. And so you do get that collapse. And in addition to the wound healing. So
is that a good thing?
Yeah. Well, yeah, because
everything tightens up.
Yeah.
Oh, yeah.
So it's like a micro facelift.
Right. Okay.
You're removing 8% of the skin or less with each treatment, and the holes close down, and you have 8% less skin. And then you do it again, same thing, So, that's kind of the latest on the horizon.
Does that hurt like heck?
It's a device that needs numbing for sure.
Yeah.
But I don't think it hurts like heck. And certainly while you're healing, it doesn't hurt like heck. But, it doesn't need like general anesthesia. We do the same topical numbing and nerve block kind of situation.
There's something called like microneedling. Is that right? Mm-hmm. Is that sort of like this, but with a machine?
Well, the difference between microcoring and microneedling is that microneedling is a solid needle that goes into the skin and makes a hole, but then the hole collapses right away. Right. So it's just like penetrating, and it's just like a wound healing response. Microcoring is a hollow needle that removes a core of skin. And the origin of this device, I think we talked about this a little bit last time we had a little podcast chat. The origin was a theory called skin copying that came out of Dr. Rox Anderson's lab at Mass General. He's the one that invented fractional resurfacing, along with Dieter Manstein at Harvard, at Wellman Center for Photomedicine. And they said, well, if you can damage fractional columns of skin and the skin heals without scarring, could you harvest those tiny columns of skin and then put them in, a burn scar for everything in aesthetics started with a burn scar origin. Anyway, and put it in a wound like a burn scar. Could you do skin grafting that doesn't leave a scar in the harvesting site, right? Yeah. And it turns out it works. Like if you can take those little tiny microcores and spit them into a wound, it heals with a better looking scar, a skin that's more normal than a scar. They're still working on it. I don't think it's been perfected yet. But it's been, studied. It's been being studied for, more than 10 years now, and it works. And I think that the one major challenge of skin copying was the engineering of the needle. Like, how do we make a needle that's so small, that's hollow, that can take a core of skin out and, still doesn't leave the harvesting site with a scar. So there's a size of a column that you can remove from the skin without creating a scarring wound healing response. And once they figured out the engineering of that needle, then it was moved into the aesthetic space as well as, being studied for skin copying. So
just imagining the thickness of the wall of the hollow needle.
Yeah.
Wow.
It looks like a regular needle. You don't notice that it's, hollow.
Wow. Impressive technology.
And then the other cool new laser that's out has nothing to do with anti-aging, but has to do with acne. Oh. So there are two new lasers that are focused on the sebaceous gland. So a brand new, novel wavelength that's selectively absorbed by sebaceous glands. And when you kill sebaceous glands, you shut down kind of the fuel to the fire of acne. So those are up and running and working well.
What causes acne?
Ooh, thanks for asking. I love that question. Well, okay, so there's 4 components to the cause of acne or the origin. And we're talking teenage acne here, because there's the teenage acne and then there's the female hormonal cystic acne, which is a totally different animal. But they both are related to overproduction of sebum. So you have a hair follicle, you have an oil gland that empties into the hair follicle. In hormonal acne, there's a lot more oil production. It's controlled by your hormones. So mostly testosterone. So if you block the testosterone receptors in the skin, female adult hormonal acne gets much better. Teenage acne also has a component. There's more oil production, but there's a component of plugging of that hair follicle. That's where Retin-A comes in, because that exfoliates off that plugging of the hair follicle. There's a bacteria on our skin. It lives in the follicle. It doesn't like oxygen and it eats oil. So a plugged pore with more oil production is like heaven for that bacteria, and it overgrows. And when that bacteria overgrows, then the inflammatory cells come in to attack it. So you've got inflammatory cells, bacteria, plugging of the pore, and if you could shut down oil production, then, all of those things wouldn't happen.
Why do you need oil production around a hair follicle?
That is a mystery. Some people say, and that it's like an evolutionary vestige of the past. So how you have sweat glands that when they secrete water so that when you're hot, you get cool by evaporative cooling. Well, oil may do the opposite, where it shuts down evaporative cooling, so you produce more to keep yourself warm. And what is interesting to me about that theory is that every year, no fail, and it's going to happen this year too, hasn't happened quite yet, but right around this time, like into October, everybody comes in with an acne flare. Oh, my acne was so good over the summer and it's just so terrible right now. And some of it probably is because, you're back at school, like there is UV light does help kill the bacteria associated with acne. You're probably eating differently, you're stressed. But the other component is the weather is starting to get cool. And so, do we make more oil production? Do we make more oil when it starts to get cold just to keep ourselves warm? I mean, it doesn't have a function now, but yeah, I mean, because we wear clothes, but
we're all animals.
We're all animals.
Wow.
But yeah, the sebum, and sebaceous gland, why it's there is a mystery, There are stem cells in sebaceous glands that are good, responsible for healing. These lasers don't remove sebaceous glands, so we have to assume that they will, your skin will still heal the same. They've been studied for long enough that I think we know that that's the case. But, yeah, other than that, there's no real reason why we have sebaceous glands except to give us acne.
Wow. I never knew any of this.
Really? Oh, great. Oh, good. Okay.
I don't really anticipate an acne flare in my 65-year-old future, but
I agree. And if you have something that looks like acne that flares, it's probably not acne. It's probably rosacea or perioral dermatitis, which is very common at high altitude. Yeah.
I don't want any of that. I just had surgery on my knee like 10 days ago. So that's enough.
Yes. Okay.
Deal with that.
Agreed.
Jimmy Buffett. You getting a lot of questions about that?
A lot of questions all day. Yes. Since we learned of his passing.
And what do people want to know about Jimmy Buffett?
So people, obviously when they hear that someone has died of skin cancer, they get very concerned because skin cancer is quite common. The type that Jimmy Buffett had is very, very rare. So all of my patients who've had multiple basal cell carcinomas and squamous cell carcinomas, which don't typically metastasize, are, kind of up in arms because they don't really understand the difference.
I see. So he had this rare carcinoma, skin carcinoma. What was it?
As far as I understand from the news reporting, he died of a skin cancer called Merkel cell carcinoma. Merkel cells live in the skin. They're associated with nerves. We consider them like the cells of touch or touch cells. So they live kind of in the epidermis. They live in the hair follicles, and they transmit touch sensation. It's a cancer that shows up on the skin. It's not subtle in any way. It's quite obvious. It's rapidly growing. It looks angry. Ooh. It's not something that you would miss on your skin. It's commonly deadly. It spreads inside kind of quickly. Yes, just like other skin cancers, it's found on sun-exposed areas, but it's associated with a virus. A research team that found the virus associated with Kaposi sarcoma was looking specifically for viruses, and they found this new virus that's called the Merkel cell polyoma virus. It integrates into our cells and creates the skin cancer that's neuroendocrine in origin.
What I'm curious about is normally skin cancer, I think of like sun, UV, but this is something else?
Well, it's definitely seen on sun-exposed areas, and there probably is an association with UV light, but it may not be as simple as UV light damaging DNA or our DNA, which is how we think of other skin cancers, which is why old sun exposure predisposes you to skin cancers today. Like even if you're very good about sun protection now, it can come back to haunt you in the form of damaged DNA. And that's not necessarily true for Merkel cell carcinoma, but there probably is a component of sun exposure because UV light is very immunosuppressing in the skin. When UV light hits the skin, it chases away the immune system in the skin and allows, a virus like that to reactivate or integrate.
There's a certain group of people out there that feel like more sun better. Like I'll be healthier if I get more sun on my skin and I'm tanned, but maybe not.
Those people should spend a week with me in the clinic and just look and see what sunlight does to your skin. It's devastating. I mean, if you live that way, you're going to look like a leather bag. And that doesn't mean you shouldn't enjoy outdoor activities, but you should do it in a sun-safe sort of way, wearing sunscreen and hats and sun protective clothing. And it's unequivocal that UV light causes skin cancer. And I think that Jimmy Buffett's situation has kind of, brought that to the forefront, that skin cancer can kill you. So I don't think it's a longevity strategy.
No. Well, I agree with you.
We talked about vitamin D levels and how that's important for the immune system and having a good immune system, but you don't need the sun to get vitamin D. You can get it from a supplement. And if you're not good at absorbing that supplement, you take more and you check your levels.
I'm one of those. I check my levels every quarter, and it took me about 6 months. Like mine were, I think, in the high 20s. And I think to get them up into the 40s, I had to take 10,000 IUs a day. And then to get it over 50, I still had to take almost 10,000 IUs a day. And now I think they're about 58 now. So I sort of alternate like 10,000, 5,000.
I like how you're doing that because you can definitely overdose on vitamin D. I actually had an elderly patient who was in the hospital with a vitamin D overdose.
Ooh, how much were they taking?
They weren't taking very much at all, but we had recommended narrowband UVB treatment for a skin condition. I can't remember what it was. This was a while ago. And as soon as he started getting the light treatments, he overdosed. So, yeah, I like how you're doing that.
It's good. Really big on testing. Yeah.
Smart.
If somebody wants to get in touch with you, I know you're in Park City, but if somebody wants to get in touch with you, how would that happen?
Ooh, that's a great question. Could they get in touch with you and you give them my information or
Sure.
what? Yeah. Okay.
Yeah, I can do that. We'll put them in the show notes. Yeah,
okay.
Absolutely. And
Perfect.
if you're in this neck of the woods, everybody I know who's like really knows what's going on, Dr. Kelly is their dermatologist. I'm just saying. I'm saying a lot of other physicians I know go to see you. So,
Thanks.
Thanks so much for coming over. It's so nice to see you and have someone here in person.
Thank you so much. I love blabbering on about, random things. So thank you.
Absolutely. Anytime.
Okay.
All right. Take care now.
Okay. Bye.
Bye. Isn't Dr. Kelly great? I just love chatting with her. I love that she just showed up at my house, just before I thought we were going to do this on Zoom, right? And I get an email like, I'll be at your house in a few minutes. I was like, whoa, wait, I got to set all this stuff up here. So we did, and it was great. It's so much better doing these podcasts with people in person. I love it. I wish I could do it all the time, but modern world. We're going to get with Just Try This after a quick word from our sponsor. Today's show is also brought to you by Inside Tracker, the dashboard to your inner health. I'm a big believer in getting blood tests taken because it's simply the only way to get in-depth data about your metabolic factors, your hormones, and the things that inform your immediate and long-term health. There are also excellent DNA tests that can further inform you about your immediate and long-term health. The problem is that most blood tests out there is you get a lot of information back and you get a lot of numbers, and they're not really going to tell you what to do about it. In addition, they can be very confusing, what all the factors are, what they mean. Inside Tracker has a dashboard and a platform that simplifies all of that. I get food first, supplements second recommendations about how to optimize my inner health. For instance, I just got my test back and I saw that my calcium levels were a little low, which were surprising to me. But I have suggestions now about how to correct that. And I would not have known that had I not done an Inside Tracker blood test. Go to insidetracker.com/ageist. Save 20% on all their products today. This week on Just Try This, we have a seasonal tip. And this is the season where it's getting a little cooler outside. At least it is where I am. If you live in Miami, probably not, but for the rest of us. And as it gets cooler, what happens is the heat comes on. And as the heat comes on, in general, the humidity inside tends to fall. And that can cause some issues. So our skin can dry out. That's not so great. Doesn't look so great. And then also for our sleep, what happens is as our nasal passages dry out, we can often wake up in the middle of the night and we're not quite sure why. I mean, we don't understand why when we wake up. But what's happening is because our nasal passages have dried up, they've sort of closed down a little bit and it causes some issues with our breathing. Consequently, it causes some issues with our sleep. So this week on Just Try This, humidity. So there's a couple of ways to deal with this. You can get a humidifier, keep it in your bedroom where you sleep at night. You can also try a xylitol nasal spray to keep your nasal passages irrigated and happy. Maybe you just like run the shower if the bathroom's like near your bedroom and close the door and keep that humidity in there. One thing to keep in mind, if you keep a window open this time of year, what's going to happen is that is actually going to accelerate the loss of humidity in the air. So this time of year, you want to sort of pay attention to that. Like, don't circulate a lot of air from inside to outside. It's just going to make it even drier inside. This week's tip, pay attention to the humidity in the room where you sleep. You're probably going to sleep better. Thanks for joining us on the show this week. It's so great to have you guys with us. Next week, oh my gosh, we have a fantastic podcast. This all comes from a paper that I read, the intersection of olfactory, that's smell, and cognitive ability, that's how well you think. Fragrance, scent, and mental capacity is on the menu for next week. That's going to be a great one. You guys, if you like this podcast, hey, I'm going to ask you a favor. Pass this off to someone you know and ask them to subscribe. It would really, really help us. And if you can, please leave a 5-star review. You can do it. You know you can do it. If you want to leave us a comment, we would love that. Please, we love comments. Until next week, everyone have a wonderful week. We'll see you then. Take care now.